The effects of stress on oral health often go unnoticed, overshadowed by more visible manifestations like systemic, emotional, and mental symptoms. In this video, we shed light on the complex link between stress and oral health, highlighting the hidden toll it takes on our teeth, gums, and overall oral wellness. At its core, stress is the body's natural response to perceived threats or challenges, triggering a cascade of physiological and psychological reactions designed to prepare us for action. While this fight or flight response can be adaptive in short bursts, chronic or prolonged stress can wreak havoc on our bodies, disrupting normal functioning and exacerbating existing health issues. The effects of stress on oral health are far-reaching, influencing the onset and progression of various dental conditions. From subtle changes in oral hygiene habits to more pronounced physiological responses, stress can manifest in many ways within the oral cavity. Some of the key ways in which stress impacts oral health include: 1. Bruxism. Bruxism is one of the most common manifestations of stress. It is the involuntary grinding or clenching of teeth, often during sleep. Over time, this repetitive motion can wear down tooth enamel, leading to tooth sensitivity, fractures, muscle tension in the jaw, and joint disorders. 2. Gum disease. Chronic stress has been linked to an increased risk of gum disease, a bacterial infection that affects the tissues surrounding and supporting the teeth. Stress-induced changes in immune function and inflammatory responses can compromise the body's ability to fight oral bacteria, paving the way for gum inflammation, swelling, and eventual tissue damage. 3. Dry mouth. Stress can disrupt the normal function of salivary glands, leading to decreased saliva production and a condition known as dry mouth syndrome. Saliva maintains oral health by washing away food particles, neutralizing acids, and remineralizing tooth enamel. In its absence, individuals may experience increased plaque buildup, tooth decay, and oral discomfort. 4. Canker sores and cold sores. Stressful events or periods of heightened anxiety can trigger outbreaks of canker sores or cold sores in susceptible individuals. These painful lesions, which commonly occur inside the mouth or on the lips, can be exacerbated by stress and may require symptomatic treatment to alleviate discomfort. 5. Dietary changes and oral hygiene habits. In times of stress, individuals are prone to engaging in unhealthy coping mechanisms, such as poor nutritional choices, increased consumption of sugary or acidic foods, and neglecting oral hygiene practices. These behaviors can contribute to the development of cavities, gum disease, and other oral health issues over time. Now let's talk about the mind-body connection. Behind the scenes, a complex interplay of physiological and psychological mechanisms underlies the relationship between stress and oral health. Stress activates the hypothalamic pituitary adrenal (HPA) axis, triggering the release of stress hormones like cortisol and adrenaline into the bloodstream. These hormones can affect immune function, inflammation, blood flow, and tissue repair processes throughout the body, including the oral cavity. Moreover, stress can influence behaviors and habits that impact oral health, such as changes in dietary patterns, disruptions in sleep quality, and alterations in oral hygiene practices. Individuals experiencing high levels of stress may be more likely to engage in behaviors like smoking or alcohol consumption, which further compound the risk of oral health issues. While the impact of stress on oral health may seem daunting, there are proactive steps individuals can take to mitigate its effects and promote overall well-being. By prioritizing stress management and adopting healthy coping strategies, we can break the cycle of stress-induced oral health issues. Some effective stress management techniques include: 1. Mindfulness and relaxation techniques. Practices like deep breathing, meditation, yoga, and progressive muscle relaxation can help calm the mind, reduce muscle tension, and promote a sense of inner peace and balance. 2. Regular exercise. Physical activity has been shown to reduce stress levels, improve mood, and boost overall well-being. Aim for at least 30 minutes of moderate intensity exercise most days of the week to reap the benefits. 3. Healthy lifestyle choices. Maintain a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, and limit consumption of sugary, processed, and high-fat foods. Avoid excessive alcohol and caffeine intake, as these substances can exacerbate stress and disrupt sleep patterns. 4. Social support. Cultivate strong social connections and lean on friends, family members, or support networks for emotional support and encouragement during stressful times. Sharing experiences and seeking perspective from others can help alleviate feelings of isolation and promote resilience. 5. Seek professional help. If stress becomes overwhelming or interferes with daily activities, don't hesitate to seek support from a mental health professional, counselor, or therapist. Professional therapy or counseling can provide tools, strategies, and coping mechanisms to manage stress effectively. We also need to highlight the role of oral health professionals and preventive care. Dental professionals play a key role in treating dental issues and in promoting preventive care. By recognizing the impact of stress on oral health and incorporating discussions about stress management into patient interactions, oral health professionals can empower individuals to take charge of their oral and overall well-being. Furthermore, dental offices can create environments that foster relaxation and comfort, incorporating elements like soothing music, calming scents, and ergonomic seating to help alleviate anxiety and promote a sense of tranquility during dental appointments. Open communication and patient-centered care are essential in building trust with patients, ensuring that their oral health needs are addressed in a supportive and compassionate way. Through mindfulness, healthy habits, and supportive relationships, we can break the cycle of stress-induced oral health issues and pave the way for brighter, healthier smiles and lives. This is it for today's video. Thanks for watching, liking, and subscribing. See you in the next video.